believe it or not, summer will be coming to an end eventually, and living in the low country makes us particularly vulnerable to the sun. Well, since we know there is a link between sun exposure and skin cancer, Dr. Marguerite Germain is going to tell us what to look for when it comes to melanoma, the most serious form of skin cancer. And she is joining us now here for our Medical Monday segment, a dermatologist of Germain Dermatology here in Mount Pleasant. Thank you so much for being with us.
Thanks, Tara.
Now, when we talk about melanoma, you usually hear the word melanoma, I feel like, and skin cancer. Why is it that melanoma is so prevalent when we talk about skin cancer?
Because melanoma is the most serious form of skin cancers. There are many other types of skin cancer, but melanoma is by far the most serious.
And the most deadly.
And absolutely the most deadly.
So what do we need to know when it comes to protecting ourselves from melanoma?
So what you need to do to think about, certainly I want everybody to have fun in the sun, but you have to be very careful about practicing good sun habits. What you need to do is you need to use a good sunscreen that has at least an SPF of 30, a UVA, UVB, broad spectrum sunscreen. You have to put on enough. You have to put on a full golf ball size amount. That's a lot to put it on, but this is what you need to cover your entire body. You have to do it before you leave the house and then reapply every 1 to 2 hours.
And that's something that's very important because you usually see people go out to the beach and they're there for maybe 10, 15 minutes, sometimes even 30 minutes, and then like, oh yeah, I need to go ahead and put on my sunscreen.
Right.
Why is it so important to put it on before you actually get outside?
Because it's not as protective if it's not put on at least 20 minutes before you leave the house. And then also you need to use some protective clothing. A hat with a 3-inch brim, at least a 3-inch brim. Sunglasses that have a wraparound capacity so that they protect your eyes. So they see now you're ready.
And you're fashionable too.
I know, fashionable. Well, I'm here with you. I have to be fashionable. But also remember to seek the shade whenever you can. Make sure you're not going out in the middle of the day between about 10 a.m. and 4 p.m. And never, ever, ever sunbathe purposely to get a tan or go to a tanning bed.
Well, what about someone who may say, well, I never get burned, so I don't think I'm at risk? Is that maybe a common misconception, or do you have to get burned just to put yourself at risk?
No, and there's no such thing as a safe tan. A tan is a response to damage to your skin. So if you have darker skin, certainly you're not as susceptible to melanoma, but Tara, anybody can get melanoma, and I want your viewers to know that certainly we're all at risk for developing melanoma.
Of course, to protect yourself, I have been over to your office and I got my yearly checkup to make sure that, I am okay.
Good.
I'm okay.
Good.
So I know we've got some pictures, a diagram of what to sort of look for if you do have maybe dark circles on your skin, or if you have a mole or something that you want to look out for. So we're going to take a look at that and then see what exactly we need to be looking out for when it comes to monitoring our own skin.
So what you have to do is you look for the A, B, C, D, E's of melanoma. A stands for asymmetry, so that one half of the mole doesn't look like the other. B is for border irregularity. C is for color variation. D is for diameter, more than 6 millimeters, so bigger than the head of a pencil eraser. And then E is for an evolving mole, a mole that looks different from the rest, a mole that is changing in size, shape, and color.
And that's sort of the progression of what it might look like there.
Exactly. But even beyond that, Tara, if any spot or mole is changing or growing or bleeding or not healing on your skin, you need to see your dermatologist.
And so should that be part of your yearly checkup, or if you have skin cancer in your family, how often should you be going in?
Okay, so you should see a dermatologist every year to do a full skin exam, but every month you should do self-exams. You should stand in front of a full-length, well-lit mirror with no clothes on. Look at the front of you, then take a handheld mirror, look at the back of you. Look under your arms, palms, soles, private area, everywhere. And if you see something that's changing, you need to see your dermatologist.
And the good news with all of this, as with most cancers, is if it's caught early, there is a great chance for survival, right?
Yes, a great chance of survival. Melanoma is very treatable and curable if found early, but if it's not found early, it can be fatal.
All right, and what are the treatment options? Would that be radiation, removal of that maybe cancerous mole?
Yes, so there's many treatment options, but the most important thing is to get that mole off your skin with a rim of normal tissue around it.
All right, excellent. Dr. Germain, thank you so much for helping us. And again, of course, we still have some warm weather here,
yes,
so just enjoy it safely.
Thank you, Tara.
Thanks for being with us.